Caitlin.
I'm Scarlett.
And today we are here to film a video for our client who has recently been cleared for physical activity. She has a patellofemoral syndrome in her right knee.
Yeah, so through assessments we determined that the probable underactive muscles would be the gluteus medius and the medial hamstring, specifically the semimembranosus, and the overactive muscles would be the bicep femoris, the short head, and the tensor fasciae latae. So what we're going to be doing is going through 4 steps to strengthen the underactive muscles and stretch/lengthen the overactive muscles. So let's get started.
Woo!
Okay, so the first thing we're going to do is inhibit using the foam roller, and we're going to work the bicep femoris short head. So what you're going to do is we're going to do one at a time. So let's do one leg, and you're going to put it under your quadriceps, so on your hamstrings, and you're going to lean to the lateral side since it is a lateral hamstring, and you're going to put one leg over top. And so what you want to do is just do one set on each leg for 30 seconds to 90 seconds, depending on the intensity, or until you feel a release, okay? So just making sure that your core is engaged, your chest is out, your scapulas are together, and your head is in neutral as you're doing this.
Okay.
Okay.
I can do this.
Yes, you can.
Okay.
Okay,
All right.
we're ready for you.
All right.
So you're
Tilts
leaning.
on the lateral side.
Exactly.
And then just cross.
Good. And just engage your core, bring your
Okay.
scapulas together.
Okay.
So let me know when you find a tender spot.
Okay. Oh, that's really tender.
Okay, let's hold it there. Okay, just continue breathing and keeping your core nice and engaged. Good breathing. Looks good. Awesome. We have 10 more seconds.
Okay.
So keep
Good,
doing
because
it.
this is uncomfortable. But it's good though.
It's helpful.
Yes.
Yes, good. Okay, 3 more seconds, and then
Okay.
we will switch sides,
Okay.
and you can stop. So now we will do the other side.
Okay.
Good. Now we want to inhibit the tensor fasciae latae. So we're going to have a foam roller like this, and you're just going to get onto it sideways, facing this way, okay?
Okay.
So it's on the side. And then you're going to bring this leg over top to support yourself like this, keeping your body nice and aligned and in neutral position again,
Right.
with your core engaged and your scapulas together. And you just want to roll, and you can lean forward a little bit just to get that nice tensor fasciae latae, which is like your pocket muscle.
Okay.
Okay. And so you're leaning and keeping everything in neutral until you feel a tender spot, okay?
Okay.
And again, holding it for 30 to 90 seconds.
Okay.
So, here you go.
Okay.
Yeah, and just roll until you find a tender spot, and let me know when you feel it, okay?
All right. I got one.
Good? Okay. Good. Keeping this engaged. There you go. Good. Yes, remember to
Got
breathe.
to breathe.
Definitely. Awesome, you look good.
Oh, thank you. I'm in pain, but it's good though.
Okay, good. It's worth it.
Yes.
Awesome. Oh, there you
Okay.
go. Almost done. And next side.
Okay.
All right, now we're going to lengthen the tensor fasciae latae by doing a static stretch. So what we're going to be doing is standing in staggered stance, slight staggered stance. So your front lead leg is pointing forward, and then your back leg, you're going to turn it externally so it's facing that way, okay?
Okay.
And so you have your hand resting on your quadricep, and with the same side that your back foot is on, you're going to raise your arm, and you're just going to bend laterally. So to the side here, you're bending. And so if this is going to stretch your tensor fasciae latae, but if you want a greater stretch, you can just move upwards so your head kind of faces up too, and you're turning slightly backwards.
Okay.
And you're holding that for 20 to 30 seconds, and you're doing 1 to 4 reps.
Okay.
So
Let's try this. Okay. So that's rotated.
that looks good.
Okay.
Bring your hand up. Yeah, and this hand's just
Oh, it's
relaxing here.
right.
And nice scapulas together and
Okay.
core engaged.
Okay.
Good. And if you want to further, you can just
Yeah.
exactly, and we'll hold that for about 20 to 30, 20 seconds. side.
Okay.
Good work. Okay, so we're going to do a static stretch for the bicep femoris now. Okay, so what we're going to be doing is just laying supine. You're having one leg up so that it can support your leg that you're going to cross over. With your opposite hand, you're going to reach under your knee, and so you can feel something that feels like a guitar string, and you're going to pull it so that you're kind of adducting, so bringing your knee inwards towards your body. Okay?
Okay.
And then you're just going to extend here, so bringing your foot up and pointing your toe down, okay? Then you're just holding this for 2 seconds. And for this one, we're going to do 10 reps of 2 seconds, and that's because there's a nerve component. And right here, there's a nerve that shoots up here and splits here, so we don't want to hold that for too long, okay?
Might pinch my sciatic nerve.
Ah, there you go. It wouldn't be good. So, let's get you going.
Okay.
Just make sure your core is engaged as you're doing this, all right? Your head looks through. Yeah, reaching over for that guitar string. Yeah, and just pointing your toe. There you go. So we'll hold it for 1, 2, and bring it down. Okay, and now we can go again. 1, 2, release, and again. 1, 2. Good, and we do 10. Okay, now we're going to be doing a neuromuscular stretch for the bicep femoris short head. And so for this one, you want to do contraction for 7 to 15 seconds at 20 to 25% intensity. And then we want to do stretch it for 20 to 30 seconds, okay? And we're doing 1 to 3 repetitions on each side. So I'm just going to support her above her knee, and then we're going to bring this up into extension and adduct it slightly, okay? So I'm holding it under the foot and right above the knee. So let's contract now. Okay, and release for 20 to 30 seconds. Okay, contract again for 7 seconds. And relax. So I'm just bringing it more adducted again. And now contract. Okay, so now we're going to be doing a neuromuscular stretch again, but this time it's for the tensor fasciae latae. So you have my client here just on her side, and I'm just going to slightly adduct here at the hip, okay, and I'm going to be supporting here just to make sure she's aligned, and then I'm going to be supporting here right above the knee and holding on to the back of her foot. So she's going to be pushing straight, and I'm going to be pushing down for the contraction phase, all right? Okay. So go contract. And relax. Now we're going to go this way, maintaining a 90-degree angle. We're going to move back. Wait 20. Okay, and contract again for 7.
What are we doing?
She's just sitting in chest.
And relax. So now I'm going to bring it back again, maintaining this 90 here,
I've been trying so
and
hard.
making sure she's nice and aligned.
You can stretch
Okay, and
before
contract.
if you want to.
It's okay. We know it's not going to be good.
Right.
Hey, I improved it at least.
And relax. Okay, so now we'll do the other side.
So we are going to be going over the activation portion of the corrective exercise continuum. First one we'll be going over is positional isometrics for gluteus medius and the medial hamstring. So for the first one, I have my client laying down, and pretty much her whole leg is going to be extended, and I'm just going to be pressing down on her leg, and she's going to be contracting for 4 seconds, and that's going to be one repetition, and in total we're doing 4. And the intensity, so for the first rep when she's contracting, is going to be 25% of her maximal contraction, and then 50, 75, and then 100%. Just for the video, we'll just be doing 3. Okay, so just gonna get my client's legs straight, just making sure the hips are stacked, so I'm just bracing right here. I'm just holding, so Scarlett, when you're ready, I'm just gonna be pressing down for 4 seconds. 25%. 1, 2, 3, 4. Good, okay, now relax. Okay, now just relax. Okay, now up again, and then this is gonna be 50%. Okay, so 1, 2, 3, 4, and down. Okay, and then we'll just be doing 75. Up, and 1, 2, 3, 4, good. And then there'd just be the one more repetition, and we would finish off on the other side. Now we are going over positional isometrics for the medial hamstring. So her legs down here just to brace, and then I'm just going to be raising this one up. Have a 90-degree angle right here, and I'm just going to rotate her ankle inwards just slightly, because then that's going to target the medial hamstring. So again, she's going to contract for 4 seconds, just pretty much bringing your heel down towards the ground for 25. Okay, 1, 2, 3, 4, and relax. Okay, then we're going to go again for 50% of your maximal contraction. Just maintaining this rotation right here. And contract, 1, 2, 3, 4, relax. Okay, now 75%. When you're ready, 1, 2, 3, 4, and good. And then we just be doing the other side. All right, now we're going over isolated activation for the medial hamstring. So what I'm gonna get Scully to do is she's just gonna step up on this box here. And pretty much I'm gonna have that ankle device strapped here, and then she's just gonna contract, bring her legs straight up, hold it for 2 seconds, and then down for 4. All right, so I'm just come on over here. Alright, so just hop up on the box. Okay, so like I said, pretty much here, I'll go over the motion ones just to help you out. But pretty much keep that still, and then just come down. Okay, and it can help you if you move your foot over a little bit, just on the box, just so you have more room. There you go. So when you're ready, just bring that foot straight up. Hold for 1, 2, and then down for 1, 2, 3, 4. Good, that's 1 rep. Let's go again. So up for 2, 1, 2, and up for 1, 2, 3, 4. Good, let's just do 1 more. And up, hold, and down for 1, 2, 3, 4. Good, and we're done, and we just do the other side. So for this exercise, we're going to be targeting the gluteus medius, and we're just going to be using this device right here just to wrap around your ankle. And pretty much what you're going to be doing is just bringing the leg out, and then you're going to be holding it for 2 seconds, and then you're going to bring it down for 4 seconds. And in total, we'll be doing 10 to 15 repetitions for 1 to 2 sets. Okay, Scarlett, so I'm just going to get you to start. So pretty much I want you to face this way. So here, I'll move. Okay. All right. And I'm just going to put this. Actually, this leg will be for bracing, so that one's going to be back a bit further. Yeah, so I'm just going to wrap that around. Oh, okay. Just come a bit closer so I can get it on there. Okay. And just double checking, make sure that's on a light level. Okay, and again, I just want your hand on here just to brace yourself. And you're just going to slightly bring your leg out for 2 seconds, and then bring it in for 4.
Okay.
So out to the side. 1, 2, then in 1, 2, 3, 4. Good. That was 1 rep. So let's go again. So hold for 2, and down for 4. 1, 2, 3, 4. Good. And let's just do 1 more. Hold. Good. Down 1, 2, 3, 4. Good. And like I said earlier, we'd be doing 10 to 15 repetitions, and we would be going on the other side. We are in our last phase for the corrective exercise continuum, which is the integration phase. So now we will be strengthening the gluteus medius and the medial hamstring. So the first one, I'm just going to give Scarlett a demonstration of what I'm looking for. It's pretty much going to be supine, just hands at your side, both knees are bent, and this one is going to be working your medial hamstring. So for this, you're just going to have your foot just a bit further past the one that's stationary, And you're going to be contracting, so almost like sliding your foot on the ground. So you're using the friction. And each time you pull, you're contracting your hamstring. And for this, we're going to be doing it for 1 to 2 sets and 10 to 15 repetitions. So let's get you lying down first. Okay. All right. So, okay. Yep, so that one's stationary in here. I just want it up just a little bit because you want a bit more room because you're going to be contracting by pulling it towards your butt. Okay, so when you're ready, we just want this slow and controlled for the movement. So when you're ready, just contract and just use the friction of the ground to slide it towards your butt. That was good. Okay, so that was one set. So let's just do 2 more. Okay, so it's out again, but you still want your knees slightly bent too. Yep, and then just when you're ready, you can just bring it back towards you. And do you feel it in your hamstring? Yes. Okay, awesome. And let's just do 1 more. So about there. Okay, good. And then just slide back. Good. Okay. And thank you, Scarlett. Okay. And we would just be continuing on the other side. Okay, so now we are doing an integrated movement for the gluteus medius. Gluteus medius. Okay. And pretty much for this one, we're just going to be using this resistance band that I have around my ankles. You're going to want your knees slightly bent. You want to make sure your chest is up, keeping your core strong. Pretty much just keep your hands up to just have it contracted, just so you have a neutral back. And pretty much you're just walking straight to the side. So just slow and controlled movement. And this is going to be for 10 to 15 repetitions, and then we'll be doing it on the other side. Okay, so I'm just going to take this off in a second. Kind of set up here. All right, Scarlett, so I'll just get you to sit down. Okay. All right. Okay, so now I'm just going to get you to stand up. Good. And I'll move that underneath. Yeah, so you just want to make sure your feet are already slightly apart, just a bit of room. So I want your knees bent. And then you want to make sure your chest is up. And then you can just have your hands up if you like. And we'll just do a few steps to the sides. I just want to make sure it's slow. Okay. And good, that's the movement. And we would just be finishing off by doing it on the other